So we'll begin with the blood vessels that are found within the neck. We'll start off with the carotid here. The common carotid actually begins coming off of the heart, and on the right side it would start off as the brachiocephalic artery and then split to form the common carotid and the subclavian on the right side. But here we're actually dealing with the left side, so we basically just have the common carotid coming up. So that you have the left common carotid coming up, and as it comes up it's going to split to form the internal carotid and the external carotid. And so you can visibly see the external carotid heading up. The internal carotid goes up, and it is going to form the middle cerebral artery as a part of the circle of Willis, which vascularizes the brain, and it will be found near the pituitary gland. As we follow the external carotid up, you'll see that branches come off and then head towards different structures. For instance, this branch comes off and actually heads and vascularizes the superior portion of the thyroid gland. So this is called the suprathyroid artery. As it then goes further up, it will then branch off, forming a branch that goes to the tongue, which will be the lingual artery, which you can't see, and a branch that comes underneath the mandible and then comes around and then vascularizes the face, which would be the facial artery, which is here. As we continue to go up, you'll see that there is a branch that heads towards the back of the head, this one heading towards the back and then coming out here. That, of course, would be the occipital artery. And then this branch right here coming towards the front, heading towards the maxilla, that would be the maxillary artery. And this branch coming upwards, heading towards the temporal bone, known as the temporal artery, or also known as the superficial temporal artery. There are multiple pulse points on the body, but some of the key pulse points that are associated with the head and neck include the temporal pulse point right here, the facial pulse point right here, and the carotid pulse point right here. As we move downwards, the jugular comes down, and there is actually two jugulars. There's an internal and external jugular, which heads down. And as the internal jugular, which is what this is, heads down, there's an external jugular that comes down, and I'll talk about that in a second. They come down and they actually merge with this blood vessel right here, which is the subclavian. And you can see that there's a spot right here where the external jugular would actually come down and attach right here. And here's where the internal jugular would actually come down and merge to that as a subclavian. When both the internal and external jugular merge together, they then form right here the brachiocephalic vein. The two brachiocephalic veins from both the left side and the right side merge together at basically this point right here of the sternum, and then form the superior vena cava. Now, as we then go from the outside of the body and then turn our way towards the inside, there are several structures that you need to be able to identify on here. That includes the cavities in the bone here, which by definition a cavity in a bone is known as a sinus. So we have the frontal sinus, and then back here we're going to have basically the ethmoid and sphenoid sini here. So this would be the ethmoid, this would be the sphenoid sini here. As we move further downwards, actually before we move further downwards, this right here is actually the hypophysis, also known as the pituitary. You can tell here's the anterior clinoid process right there, and then that would be basically heading that way, so forming around the pituitary, and that's of course the hypophyseal fossa to which it sits. As we move downwards, we then see behind the nasal cavity this little opening right here called the pharyngotympanic tube, which is what equalizes the pressure on your eardrum. And then above that would be the tubule tonsil, which is where basically as air comes through, particles like viruses and bacteria can actually drop down into the tonsil, and that can then lead to the infectious response, and that leads to fluid leaking into the pharyngotympanic tube, which is why your ears stop up when you have a cold. And so then as we move back this way, as we move downwards, you have of course the nasopharynx, and then back here we have the oropharynx, and then down here we would have the laryngopharynx. Now in the mouth, we can see that there are still some additional muscles that you need to be able to identify, which includes this muscle here, which runs from the chin to the tongue. And because it runs from the chin to the tongue, the first part of the name is of course genio, which means chin. And then glossal, which means tongue. So genioglossus is what this muscle is right here. Below that, we have this muscle right here, which is running from the chin to the hyoid. So this is going to be the geniohyoid right there. And then below that is going to be this muscle right here, which is going to run across the mandible from one side to the other and attach to the hyoid. So this muscle right here is the mylohyoid. And you can actually see the mylohyoid is just below the digastric right there. So that's again that. Now we can see here we have the thyroid cartilage right here, and there's a protrusion on the thyroid cartilage. This protrusion on the thyroid cartilage is known as the Adam's apple, but its scientific name is the laryngeal prominence. So if you ask me and say, Dr. McCollum, which answer would you prefer on the test, Adam's apple or laryngeal prominence? I will tell you that I would prefer the scientific name that is used to identify that structure. So if you put Adam's apple on your test, I will mark you wrong. So make sure that you put laryngeal prominence. Now, you'll see here that this structure right here that is sticking out right here, that's behind the throat, behind the tongue, this of course is the what's called the epiglottis. It's called that because it actually surrounds the glottis. That's why it's called the epiglottis, because epi means surrounding or going around. And what does it go around? The glottis. What is the glottis? Well, the glottis is, of course, your vocal cords and your area where your vocal cords are. So this closes over top of the glottis, which would be this area here. So it protects your trachea from actually having food or particles or fluids from getting into it. And so one of the unique things about the epiglottis is, of course, it's made out of elastic cartilage. And there are only two structures that are typically associated with elastic cartilage: the epiglottis and the outer part of your ear. Now, you can see here that there's nasal cartilage here, which is made out of hyaline cartilage. So you need to make sure you know that. So hyaline cartilage here. The thyroid cartilage is also hyaline cartilage, so make sure you know that. That's AP1 material that you should already be familiar with, so nothing new there. Now we'll move from this model here over to this model over here. And we'll see again better on this model than on the skull, these shelf-like protrusions here, which again are the nasal concha, superior, middle, and inferior nasal concha, and then of course the depressions just below them, which would be the superior, middle, and inferior nasal meatus. Okay, so that's what those are there. Make sure that you know that the hard palate is made up of the palatine process of the maxilla and the palatine bone, and that this structure right here, which is known as the uvula, means grape or swollen. So there are some key terms and words that you need to know and pay attention to through these videos that I have thrown at you, and they will probably be used as bonuses. So make sure you pay attention. All right.